must agree that the health of the nation is the wealth of the nation, but healthcare is expensive. The Universal Health Coverage Project will continue to work with other departments under our parent Ministry of Health, Wellness and Elderly Affairs to be able to launch services within the essential package of health services in a phased manner. We are currently looking at a finance model, which is a 3-tier model. We're working along the consultants from JIPA, Joint Independence Providers Association, to be able to develop this model, which actually is the base for the UHC bill, which is in review. The 3-tier model takes into consideration on Tier 1, the essential package of health services, which all St. Lucians will benefit from. And it takes into consideration a consolidated model where monies that's already out there within the finance system in St. Lucia will be, a certain percentage will be placed in that special fund, which will be used to fund the healthcare in St. Lucia. We're also working to put in a fixed amount of money per St. Lucian, per annum or annually, to be able to fund the Tier 1 or the essential package of health services, or even beyond the essential package of health services, which takes into hospital care. This particular model also allows us to have conversations with the insurance companies, which we've started. And usually the insurance companies, they tend to not to want to bring in persons with non-communicable diseases or communicable diseases, or persons who are retired, the older persons with more comorbidities. But we have been liaising with them in ways in which they can start creating packages so that they can work along within the model to be able to provide care to persons and no one is left behind when you're looking at the upper tiers like Tier 2 and even Tier 3, which takes you beyond the shores of St. Lucia. It is important to note that persons who cannot afford any form of care, when any form of payment towards healthcare, they will not be left behind, because in the model we are considering persons who are unable to pay for the healthcare.